Good afternoon. This is your Congressman Van Taylor calling to invite you to participate in a very important telephone town hall with Collin County seniors to discuss the coronavirus and answer your questions about the government's response. So this is a live telephone town hall meeting. I'm Van Taylor. I'm your U.S. Congressman here in Collin County, and I'm joined with representatives of the AARP, the Social Security Administration, as well as State Representatives Matt Shaheen and State Representative Jeff Leach. We also have Dr. David Winter, who is an expert geriatrician from Baylor Scott and White. If you've never participated in a telephone town hall meeting, this is how it works. We're currently dialing 60,000 seniors throughout Collin County, and many more, or hundreds, are actually calling in right now. And if you want to join the call and ask a question, hit *3 on your phone anytime during this call. So over the next call, it'll be about an hour. Hit *3 at any point in time, and you will be temporarily removed from this town hall event, and a member of my team will ask you for your name, your city, your question or comment, and then we'll add you back into the event. You can also hit *3 if you want to sign up for our coronavirus email alerts, or if you want to hear more. If you want to hear more of these telephone town hall meetings, you can hit *1 on your phone right now. So hit *1, and we'll put you on the log and make sure you know about all the future telephone town hall meetings. If some reason you're disconnected, you can call back 855-731-4614, or you can go online to stream the event live at vantaylor.house.gov/live. And for those of you that have a question, you'll be able to listen to the event until I'm directly connected with you, and then able to ask your question for all the listeners to hear. You can ask it for the thousands of people that are on the phone call, and then we'll direct it to the right person to answer your question. In addition to asking a question, if you've got just a comment, if you want to leave your email address and have us email you in the future, if you have an issue or concern that that this call is prompted, you say, hey, I need some help with this, just hit *3. Leave your comment, concern, your information, or your email to sign up for our newsletter, and we can definitely help you with people that are ready to help. And if you want to participate in future telephone town halls, you can also go to my website by going vantaylor.house.gov/coronavirus alerts, and so that's where you can sign up for the email. And if you want to receive further updates from my office, press *1. Just hit 1 on your phone. Just if you hit the number 1, you can get an update in the future. And if you want updates that are specific to senior citizen, you can go to vantaylor.house.gov/seniors, and there's a specific update, and we have a page. We're updating that all the time with the latest information. And as people ask questions, and we realize there's a frequently asked question, maybe your question will be put on that page. So we really appreciate you asking questions, because if you've got that question, other people have that question, is what we've found. And before and again, just for those of you who just joined the call, this is Van Taylor. I am your U.S. Congressman here in Collin County. This is a live telephone town hall event, and we're going to be taking questions directly from you here in just a few minutes. First, I wanted to get our two elected officials to have some comments. And so first we have State Representative Jeff Leach. Jeff Leach represents House District 67, which is parts of Allen, Plano, and Richardson. And Jeff has been a great leader here in Collin County. He's been a champion of public education. Jeff, Representative Leach, would you like to give us some comments?
Congressman Taylor, thank you so much. Thanks to each of you for joining our call today. This is a great opportunity for us to answer your questions, to address any issues or concerns you may have. And we've got a great team on the call ready to help you with that today. But really, as Congressman Taylor just pointed out, this is an opportunity for us to hear from you. What issues are on your mind, on your heart? What's keeping you up at night? What questions have you tried to get answers to, maybe unsuccessfully? And so there's a number of ways you could do that today. Of course, you could wait and see if someone else asks your question or shares your concern, or as Congressman Taylor pointed out, if you want to press *3 today, you'll be connected with one of our trusted staff members who can hear from you if you want to ask a question on the call to us where everyone else can hear. We hope to be able to get to you, but even if not, if you've just got your own situation that you're dealing with, your own circumstances, your own specific questions, please, as Congressman Taylor said, press *3, and you can connect with our staff members. Thank you for joining us today. We're in this together. We've gotten some good news that there seems to be a light at the end of the tunnel here, that what we're doing in terms of social distancing and hygiene and staying at home is working. That said, while we need to continue to do those things, we're in this together and just need to stick together, rely on data and doctors, and try to get Texas open as soon as possible, but also take care of the health and safety of our fellow Texans. And that's what we're going to do. That's what this call is all about. So thank you. God bless each of you. Look forward to our chat today.
Thank you, Jeff. Really appreciate you being on this call and appreciate your leadership for all of us here in Collin County. And just wanted to reiterate, so I'm Van Taylor. I'm your U.S. Congressman. This is a live telephone town hall meeting. It's a free event. We're calling tens of thousands of people, all seniors, throughout Collin County, and they are coming on the line. We have hundreds of people on the line right now who are all listening from all across Collin County, and we have some very special guests. We just heard from State Representative Jeff Leach. We also have Tina Tran, who's the State Director for AARP Texas, Dr. David Winter, who's a doctor with Baylor Scott and White, as well as a representative from the Social Security Administration. So if you have questions for any of these people and you want it to be asked of just them individually, you want them to get back to you, hit *3 on your phone right now. You'll go to one of my operators. They'll take the question, and they can get back to you later. And if you also have a question that you want to ask on this live telephone town hall meeting that you can ask in front of everybody, just hit *3, and we'll take your question down, get your name, get where you're from, and then you'll come on live onto the call if we have time for you, and then we will answer your question. So with that, I want to now introduce a great state representative, Matt Shaheen, who has been, he's a technologist, he's been an IT executive, and we're very fortunate that a man of his caliber would step up to serve in the Texas House. He serves in House District 66, a very important House district, one that I had the great fortune of serving in this Texas House before I was elected to the Texas Senate and now into Congress. So Matt Shaheen, who is from Plano. Matt, would you like to take a few minutes to introduce yourself?
I would, Congressman Taylor. Thank you so much for pulling all of us together like this, where we can interact with our constituents. This is so important, especially during really these unprecedented times. You know, I just want everybody to make sure that we all understand, you know, never before have we taken this amount of action to keep people safe and keep people healthy. I mean, the work being done at the federal, state, and local level is really unparalleled. And I want to thank each and every one of you. So many people really across the state of Texas and across the nation are following the guidelines by health experts, and it's having an impact. All of us look at the statistics, at the metrics that are released at the state level, at the county, at the city level, and we're having an impact. We actually see some glimmers that the worst is behind us. Collin County actually peaked in the number of cases back April 9th. And there's been several days, in fact, 7 of the last 11 days, we've actually seen declines in the number of cases. And we actually have 131 more recoveries than we have current cases. In fact, in Plano, there hasn't been any new cases in the past 2 days. So we're having an impact. We're certainly not out of the woods. We've got to continue to carry on with our precautions. But, you know, we as a state, our community here in Collin County, in our individual districts, we really are having an impact. We're keeping people safe. We're keeping people healthy. And I just want to remind everybody, you know, I know this is so difficult. This has been difficult for me and my family personally. And I know many of you feel alone during these times. I know you miss seeing people, just having a normal day of life. And I just want to make sure you understand and just remember that you're not alone. You know, Texas is a great state. It's made up of 29 million strong individuals, and we're going to get through this. This is temporary. This has certainly had a beginning. I think we've seen the peak, and it's going to have an end, and we're going to get through this together. I want you to know that me and my staff are there for you. Anything that you need, we've handled well over 1,000 inquiries just about the coronavirus. So we're here to help you. We're working a lot of late nights and weekends, but that's what we're here for, is during cases like this. We want you to lean on us. So please feel free to reach out to me and my staff, and we will get back to you as soon as possible. So Congressman, thank you so much for doing this. I'm looking forward to engaging with our constituents and answering questions.
First, Shaheen, thank you so much. Really appreciate you taking the time to be on here with all of us. Our next person I'd like to call on is Tina Tran. She's the State Director for AARP Texas. As we know, AARP is a premier advocate for senior citizens across this great land, and I've worked closely with them to help improve our healthcare system here in Texas so that we take care of people when they're leaving the hospital, and they're absolutely terrific. Tina, would you like to make a couple brief remarks?
Yes, thank you so much, Congressman Taylor. And really, we just want to thank you for allowing us to be with you on this teletown hall with the distinguished guests that you have today. In your congressional district, we proudly represent 70,000 members, many of whom I hope are on the call with us today. Across Texas, we have nearly 2.3 million members, and just we've in the last few weeks, we've been advocating on their behalf at the federal level, at the state level, and at the local level. And we are also doing a lot of these teletown halls on a weekly basis. Tomorrow, we have one with U.S. Senator John Cornyn. On Thursday, we'll be doing a nationwide teletown hall regarding long-term care facilities and how caregivers can advocate for their loved ones. And we have a clearinghouse website really where a lot of your constituents can find this important information, as well as get connected to volunteer opportunities. And if they need some help, they can also go to this website. It's aarp.org/coronavirus. And they'll be able to request a phone call. We know social isolation is a huge problem during this time, particularly for seniors who were really facing social isolation at disproportionate rates before the pandemic, and certainly even more so now. They can request that somebody call them on a weekly basis. And it's really just to have someone to talk to check in and make sure that, you feel that connection to the world still while we are going through this together, but however, safely keeping our social distance. So I don't want to take up too much time, but I look forward to being on the call with your constituents today. Thank you.
Thank you so much, Tina. Really appreciate having you on. And so if you have a question for Tina or State Representative Jeff Leach or State Representative Shaheen, or even for me, for your Congressman Van Taylor, hit *3 on your phone right now. An operator will take your question. And regardless of whether or not we get to the question during this telephone town hall, we will get back to you, or we will route the question to the appropriate person. So if you have a question for Dr. Winter, we don't get to it during the telephone town hall, if you hit *3 on your phone, you can ask the question. We'll get it to him. We'll try to help you get an answer back. And so with that, I would like to have Dr. David Winter, who's a doctor at Baylor Scott and White. Dr. Winter, would you like to give us 3 minutes of comments?
Sure, Congressman. Thank you very much for this opportunity. I'm an internal medicine physician at Baylor Scott and White Health, and I split my time between administrative roles and also an active panel of patients. So I've had a different experience with this pandemic. It's certainly changed our world. For the past 3 weeks now, I spend most all my time with telephone or video visits with patients. I've seen a couple in their home, but most people don't want to come in. And we found that we can actually take care of a lot of folks with telemedicine. It's a new technique that we've learned quite a bit. Fortunately, none of my patients have been found to be positive. I say none that we've tested are positive, but we know that we're not testing everyone. We can't right now. There's a shortage of testing. We expect when we test more widespreadly, we'll find there's a lot of people out there who have had minimal or no symptoms, but have been exposed to the virus. Now, this virus is a new virus, new to the human species, and it's extremely contagious. That's a talent this virus has. It's very important for the virus to have this because this virus cannot live outside of a human cell. It can live in some animals, we're told, maybe bats, but right now it's in the human species. And if it is in a human and the human survives that, then it survives it because it kills the virus. So the virus must spread from one person to the next to the next. The virus actually hijacks the machinery of human cells and turns that machinery into making more viral particles. So that's the way that it survives. And it's pretty darn good at that, we've found out. We're anxious to get more testing. I think that'll make a big difference. In the meantime, what we're doing now, was mentioned by State Representative Shaheen, is working. Social distancing, careful hand hygiene, wearing masks when in public has made a huge difference. You can just look at what happened in New York City, what's happened in Italy, other countries around the world. We have not seen the huge peak in Texas, and particularly in North Texas, that was anticipated. So what we're doing now, I think, is very, very important. But we've got a lot more to learn about this virus. We learn new things, if not every week, sometimes every day, new things we found out about this virus and how to control it. So lots more to learn. But I think even though we've hopefully passed the peak, or we're in it, or about to decline, we still have to be very careful, because this virus is not going away, and it's extremely contagious and extremely dangerous.
Thank you, Dr. Winter. Really appreciate having your your expertise on the phone. And I see we already have got some questions for all the experts on here. And we also have we have Lee Avalar from the Social Security Administration here to take your questions. And one question that has come in, so again, this is Van Taylor, I'm your congressman, and that has come in, people are asking about non-tax filing for Social Security recipients or railroad retirement beneficiaries, and you have dependents under age 17, you need to enter your information online by tomorrow, Wednesday, April 22nd, to get your extra $500 per dependent child. So if you are in that box, right? So you're a Social Security recipient or you're a railroad retirement beneficiary, and you have a dependent under the age of 17. You need to go to irs.gov, enter your payment information there, and then you can get your economic impact check. And so with that, I want to thank the people that have already gotten on and pushed *3 to ask their question. And regardless of whether we get to you on the call, we will get back to you about whatever your question is, or get it to the appropriate person. So our first question is for Lee, who was with the Social Security Administration. And I think we've got Suzanne from Wiley. Suzanne, are you on the line?
Yes, Congressman, I am.
Okay, great. And so you had a question about stimulus checks. What is your question?
Originally, we had been informed that as a Social Security recipient with direct deposit, we would not be required to fill out any additional forms or anything, that it would just be an automatic deposit. However, we have not yet received our stimulus checks, our stimulus payments, and we're curious if that has changed. What is it do we need to do?
That is a great question. I actually asked my in-laws that question just yesterday, and we've got Lee with Social Security Administration. Lee, could you answer that question, please?
Absolutely. Thank you, Congressman Taylor and Suzanne. The Social Security beneficiaries who generally receive direct deposit, direct express, or a paper check, those benefits will start arriving next week. So if you're receiving Social Security retirement benefits or SSI, yes, they'll start coming in next week.
Super. Thank you so much. Appreciate you asking that question. And thank you for the answer, Lee. That was very, very helpful. And so our next question is for Representative Jeff Leach. We have Monty in Frisco who has a question about unemployment benefits. Monty, are you there?
I am.
Okay, Monty, why don't you ask Representative Leach a question?
So I'm unemployed, and I have not seen my stimulus check first, and I've checked online, and I can't get any additional information about it. Also, secondly, I heard that there was a $600 a week added to unemployment, and I have not heard or seen anything about that, and I was wondering what the status was.
Sure. So, Representative Leach, why don't you tackle that first question that Monty had there about signing up for unemployment?
Sure, Congressman. And Monty, thank you for your question. I'm not sure if the connection issues were on my end or your end, Monty. Had a little bit of trouble hearing the entirety of the question, and I apologize for that, but I think I did get the gist of it. So if you've applied for unemployment benefits with the state, the Texas Workforce Commission, and you're having a difficult time breaking through the logjam, as you can imagine, TWC is more overloaded than they've ever been, the Workforce Commission, online and over the phone. Having said that, we have been able to assist dozens and dozens of folks to break through that logjam, to help answer their specific questions. And so if you'll reach out to me or my office, Monty, after I answer your call, you can push *3 and get us your information. We'd be happy to partner with you to lock arms and to figure out your specific situation with respect to your unemployment benefits through the Texas Workforce Commission. We would be happy and eager to help you with that. I hope I answered your question, Monty.
Sure. Monty, thank you. And I'll just add on to that. This is Van Taylor, your congressman. While the Texas Workforce Commission is a state agency, it is an agency run by the state of Texas. My office has become fully engaged in helping people get their unemployment benefits. Let me just recognize that the coronavirus is not just a health emergency. It has created tremendous economic hardship across our country and definitely here in Collin County. And the layoffs, the businesses that are struggling, it's truly heartbreaking. And so something that's really important is to help people like yourself with their unemployment benefits. The Workforce Commission, as Representative Leach said, is truly overwhelmed. They have increased the number of servers from 2 to 20. They've increased the number of people that are answering phone calls from 100 to 1,000. They've had to hire more people to really augment the kind of demand that there is. The Workforce Commission is winning back. They're gaining ground. They're starting to make more outbound calls. We're seeing fewer inbound calls as they're getting things settled. They are. And the question about your $600 check, it is retroactive. It begins on April 4th. That is the time when Texas entered into an agreement with the federal government, which is what the legislation said. That additional $600 per week. I think I said month. That's incorrect. It's per week. That additional benefit was something that I voted for in the CARES Act that passed the U.S. Congress, I believe, on the 27th of March. And so that additional funding for unemployment benefits is to help you get through this incredibly difficult time. So thank you for asking that question. There are a lot of people that have that. And feel free to reach out to Representative Shaheen's office, Representative Leach's office, or my office, Van Taylor. We're happy to help you with this. There is so much need. Our next question is for Tina Tran with AARP. Yusuf in Frisco has a question about activities for seniors. Yusuf, are you there?
Yes. Thank you.
Okay, great. Could you ask Tina your question?
Oh, my question is about the grow at the Frisco Commons. Are there any plan to open the grows? Most of the seniors are at home and they want to get away, and that's the one good place to go there. And I understand that they have to have some precaution, temperature at the gate, or they have to wear masks, things like that. But at least people can get out of the house and go someplace. So I wonder when the grow is going to open.
So, Tina, take it away.
Sure. So, Yusuf, thank you for your question. I don't know specifically about the groves. However, I think you can probably listen to your local officials on the stay-at-home orders and when those might be lifted at certain facilities. However, I would recommend following the CDC's guidelines, particularly for seniors who are in a particularly vulnerable population and that the coronavirus is really affecting disproportionately. Of course, we want seniors to have activities and to be active during this time. However, we really need to err on the side of precaution and preventative measures while we're waiting for the pandemic to sort of get through the worst of it. So I think for now, it's really important that seniors are connecting by phone, by virtual means if they have an internet connection and other ways. Unfortunately, right now is not really the time to be out there. And I also, perhaps Dr. Winter can also give us some advice on seniors and their level of activity during this time.
Thank you.
Thank you for that. And let me just say a couple things. One is that you are seeing Texas start to open up again. One thing that some of you hopefully are aware of is that Texas is going to begin elective medical procedures starting tomorrow, Wednesday. Our state parks are opening up also tomorrow, Wednesday. But you still have to wear masks and there's social distancing. So you're watching some returns to normalcy. I think that you're going to see a logical progression that will be data driven as Texas opens itself up. And so Tina, thank you for that, answering that question. And certainly it's really important for seniors to continue to stay connected with their families, and that's why the VA is working on handing out phones so veterans can connect with people. And if you need more information about that, reach out to my office or hit *3 and say you want to know more about the VA handing out phones for people to connect, for veterans to connect. If you've got another question, hit *3. Happy to answer any and all questions. We've got a lot of great experts on the line here with Representative Leach, Representative Shaheen, Dr. Winter, and representatives from the AARP and Social Security Administration. Dr. Winter, I think, has got a question. Cheryl in McKinney has a question about antibodies. Cheryl, are you there?
I am, thank you.
Cheryl, what's your question?
It's a two-part question. I think I might have had a virus in March and would like to know if I have antibodies. But more importantly, are we going to use antibody testing to get the community back to work? And if so, how do we find out where to get that?
Dr. Winter, do you want to take that question?
Yeah, happy to do that. It's a very important question because we know from other illnesses, when your body fights the illness, the infection, it builds up antibodies, and antibodies from your own immune system is what kills the virus in this case, or bacteria in other instances. So if you build up antibodies, then that actually tells us that you've had the disease, and you may, we think, be immune to getting it again. There's still some work to be done on that. Now, antibody testing is not widely available right now. We've been told it'll be available in a couple of weeks. The machines actually are available, but the chemicals, what we call reagents inside that make the machines work, are not yet widely available. A lot of these are being made in China, actually, but we hope to be geared up for that in a couple of weeks, and that'll be very, very important. And I think to your point, Cheryl, it'll help us know where we need to probably continue to isolate, where we might be able to get out more if we find a large number of positive antibodies in people who've had the virus. Interesting studies have shown that in some instances, 20% of the population has had the virus and had no symptoms at all. And in other instances, 80%. So we don't know where we are in North Texas with this, but in some areas, we're going to find that a large number of people have had the virus before and may have limited ability, maybe even be immune to getting it again. So antibody testing is very important. It's not widely available now. And so we've got our fingers crossed we'll have that very soon, which can make a big difference in everybody's health.
That's great.
Winter,
thank you so much.
Yeah, thank you, Dr. Winter. Cheryl, thank you for that great question. I really appreciate that. This next question is for Representative Shaheen. Tom in McKinney has a question about opening up the state of Texas. Tom, are you online? Tom, hold on one second. We're going to get you on. Tom, are you there?
Yes, can you hear me okay now?
Oh, super. Yeah, we got you. Tom, what's your question?
Okay, sorry about that. Yeah, as a small business owner and owner of some commercial property, our concern in talking to the business community, and sometimes we feel like there's not Am I cutting out?
No, Tom, we can hear you.
No, go ahead. Go ahead.
In our community, our concern is we're talking a lot about sheltering and this and that, but we don't feel like there's enough discussion about opening business sooner rather than later. And I know you mentioned the steps the governor's taking right now, but most of us feel those are much too timid. We need to be looking at how to open business and keeping the people that are at risk, protected. And so that's one thing. And then another thing I wanted to add real quick is just to see the burden that's going to come down on business if we don't make some adjustments real quick is the property tax situation for commercial property owners we have property in downtown McKinney that property taxes doubled 5 years ago. They've gone up 20%, 40% some years subsequent to that. Property owners and small business owners are going to get killed at the end of the year if there's not a big adjustment to property taxes this year. I would suggest the legislature go into special session and get back to work on that.
Tom, thank you. Really
Tom,
appreciate your question. Matt, do you want to take that?
Yeah, definitely. Tom, thanks for your question. Let me tell you that is top of mind really for all of us, right? We're trying to do this balance of certainly keeping people safe and protected and healthy, while at the same time we are very aware of the economic implications. And I will tell you, as a state as well as Collin County, we've actually been talking about how do we reopen, how do we get back to normal with a very big focus on our small business as soon as possible. It's clear that really throughout the state of Texas, our small businesses are our primary job engine, and Texas leads the nation in job creation. So we've got to get our small businesses back up and running as soon as possible. There's a couple of different opportunities for our small businesses through the SBA, Small Business Administration, with respect to disaster loans and paycheck protection that we hope you're taking advantage of those. If not, our offices are available to help you with that. But that is top of mind. There's actually a strike force here in Collin County headed by Collin County Judge Hill that several of us on this phone are actually members of, and we're having discussions about addressing the economy and getting back up to normal. And then with respect to property taxes, we definitely hear you. We actually had a really good last session on property taxes. We actually passed new legislation that limits the growth of your property taxes, and we actually lowered the school board property taxes, and we also did significant amount of work in reducing the Robin Hood payments with property taxes. So we are well aware that there's more to do, and stay tuned. We'll be looking at property taxes again next legislative session. Thanks for your question. I know that's on a lot of people's mind.
Thank you, Versa Shaheen. Really appreciate your leadership, Matt, and I know you've been a big advocate for reducing the burden of property taxes on hardworking citizens, and definitely, I know you faced a lot of opposition in the State House about that, so I appreciate your courage and willingness to stand up and do the right thing in the face of difficult odds. Our next question is actually a question for me. Thomas from McKinney, you've got a question about testing in Collin County. Thomas, are you there? Thomas?
Yes, I am.
Thomas? Oh, here you are. What's your question, Thomas?
I was just wondering if there was ever going to be testing up in the Collin County area so it's closer to home.
Sure, absolutely. So we have, let me first kind of back up and say that HR 6074, which was passed in the middle of March, that actually provided funding for testing, so testing should be free. The federal government is still working out the payment components of that, but that is the intent, and the money, tens of billions of dollars were appropriated for that. We have numerous locations for coronavirus testing. The first step for that is if you think that you've been exposed to the coronavirus, or you think that you might have it, that you're sick, you're coming down with it, is to call your healthcare provider first and foremost. Please do not show up to the ER. Do not show up in the doctor's office. call first and set that up so that you can expose as few people as possible. We're trying to reduce the spread, and so this is a really important step. So if you know anybody that thinks they may have it or they think they need to have it, you should definitely call ahead of time. And we have numerous drive-by testing locations around Collin County. The Texas Health and Human Resources website has got information on that. And also my own website, vantaylor.house.gov/seniors, has a link to the website. And actually, I'll just go off script here for a second. Dr. Winter, do you want to just answer any questions about getting testing and maybe elaborate on what I just said about the right way to go about getting tested for the coronavirus, Dr. Winter?
Yes, indeed. Testing is about to become more available, but it's been restricted. In fact, we're trying to limit that to folks who have symptoms. With no symptoms and maybe some exposure, we've not been able to do a lot of testing on those folks, but we want that to expand very quickly. The only way we can control this virus is to know where it is. As I mentioned earlier, a lot of folks have minor symptoms. They may call it allergy symptoms. That could be coronavirus, or no symptoms at all. So we want to do more and more testing. So with the Congressman's help, we'll happily have more testing sites available in the near future.
Yeah, and let me just say, I was actually, just before this phone call began, I was talking to Susan Fletcher, who's a county commissioner here at Collin County. Most of us know her very well. She's a great leader. And was talking to her, the Collin County currently has 16 epidemiologists, so full-time healthcare professionals are working on this around the clock. And they have teams of dozens of people who are actually doing contact tracing. And so if you're following the Collin County numbers, the number of people who are under monitoring is actually over 1,000, and that's a direct result of the hard work of the Collin County Health Department, who, once we find an active case, we're then going in and trying to figure out who everybody that they spoke to or worked with or saw in the time that they may have been infected prior to being detected and tested. And so that is hopefully going to reduce the spread of this disease and help us to further get control of it. So that's an active effort that's going on right now here in Collin County. In addition to having the testing facilities up and running, we're having an active contact tracing. If you've got a follow-up question about that or anything else that you want to ask on this call, or there's some comment that you want to make that just you don't want to, but you do want one of us to answer, hit *3 on your phone right now. And the next question is for Representative Leach. I've got Larry from McKinney. And what is your question? I think it's about something about doctors. Larry, are you there?
I am here. I know
what is
that
your
some
question?
businesses were called essential and others were not. And I know there's going to be a phased startup of opening up businesses. But, I don't really care when my local restaurant opens up, but I really want to know, when am I going to get to go back to my doctor?
Great question.
Larry, Larry, that's a great question, and thank you for pointing that out. As Congressman Taylor mentioned earlier, the governor did announce that tomorrow, April 22nd, the list of essential medical services is going to greatly expand. And so you're going to be a lot more free tomorrow to go see your medical provider to get certain expanded medical procedures. For instance, more diagnostic testing will be available, more dental procedures will be available, more procedures across the board will be considered quote unquote essential, Larry. And so I want to encourage you to reach out to your healthcare provider and ask if that service, whatever service it may be, and we don't need to discuss that on this call, whatever service that may be is going to be available tomorrow. I'd be willing to bet that it would be. If not tomorrow, then certainly very soon, possibly later this month, next week, or in early May as well. So again, if you reach out to them and still have questions, please reach out to my office, Congressman Taylor or Representative Shaheen, and we'd be happy to walk you through that. But be assured that tomorrow that list of essential medical services is going to greatly expand pursuant to Governor Abbott's order.
Yeah, Larry, thanks for asking that. And I'll just say I was talking to the CEO of a hospital there in McKinney, Texas, that does elective procedures only. They traditionally would have 90 anesthesiologists on their payroll at any given point in time. And because of COVID, they went down to 6 anesthesiologists. And so Governor Abbott's order is going to let them go back up almost to completely full speed starting tomorrow. So that's a huge, and so understand that is a tremendous economic hardship for that hospital and for all the employees of that hospital, whether they're doctors, whether they're nurses, whether they're the janitor mopping the floor. So it has been very hard on a lot of people to have no elective procedures, and obviously the patients, right? The people that need those medical procedures, that need that hip replacement, that need that biopsy, that need that spinal surgery, they couldn't get them, and so that's going to change tomorrow. Very grateful for Governor Abbott. I think that's and what drove that primarily was PPE burn, so burn on the personal protective equipment. In staying in the medical vein, we've got a question here for Dr. Winter. Jim in Plano has a question about building up immunity for Dr. Winter. Jim, are you there?
Yes, I am. I just was wondering.
Jim, what's your question?
Yes. What would you suggest for building up our immune system? Everybody's been sheltered. If they go back out, they need to have their immune system built up.
Great question. Dr. Winter?
I think that's extremely important to realize that your immune system is somewhat in your control. And so what can you do to build it up? You want to get adequate sleep. You want to have a healthy diet. You want to exercise on a regular basis. Those three things can make a big difference. And folks that do that are less likely to get the illness. And if they get the illness, they're likely to have a milder case of it. So work at that. Recent studies said people that exercise for 30 minutes a day are less likely to come down with coronavirus. I was very excited to see that. So those three things in particular can make a big difference.
Great. Thank you so much. Appreciate that, Dr. Winter, and thank you, Jim. Appreciate that question. Our next question is for State Representative Matt Shaheen. Gary in Richardson has a question about state efforts to acquire medical supplies. Gary, are you there?
Yeah, I am.
Gary, what's your question?
Well, the last time I did research, there's about $10 billion in the Texas rainy day fund. Looking at is Governor Abbott going to release any of that money to help the state purchase test equipment and the supplies required to do those tests so people can go back to work or know that they shouldn't be back at work?
Great question.
Sure,
Thank
Gary,
you very much,
thanks
Gary.
for that question. Yeah, thanks for the question, Gary. Yeah, both the manufacturing and the distribution of like personal protection equipment has been a big priority for the state for quite some time. In fact, the governor put together a procurement strike force just for the purpose of being able to acquire, the masks, the gloves, the gowns, the respirators, and we've been quite successful. So it's not an issue whether we have enough money or not. The state of Texas actually has designated disaster funds that are set aside that we actually budget for every year. So we don't even need to dip into the rainy day fund for these medical supplies. We actually have funds available for different types of anticipated disasters that might occur for the state. For example, we have a hurricane fund for those types of disasters. So the dollars are available. It was more of an issue of manufacturing and being able to manufacture. It's just this massive increase in demand in masks and gloves and respirators and those types of things. And again, the governor that I mentioned, the governor put together a strike force, and we're actually just the state by itself. So this is in addition to your private sector hospitals, doctors, what have you. The state, we're procuring about 5 million masks a week. And I think we're actually higher than that now, but about over 5 million masks a week, about 3 million gloves a week. So one of the things that we've been doing is anticipating a worst case scenario with respect to the state. We've been blessed that we're not a hot spot, but we did make preparations just in case we were. So we actually made additional preparations that I don't even think we'll have to use, but we actually have 21,000 beds that are available throughout the state of Texas. 2,000 of those are ICU tests. So we're well prepared. Dollars are not the issue. We have the funds. It's more along the lines of repurposing some of the manufacturing facilities getting those distributed, and we're actively engaged in that. And then I wanted to talk real quick about the test sites. Collin County was actually one of the first counties in the state to get a testing site. We now have 2 sites in Plano. There's one at Baylor Scott and White, and then there's urgent care for kids that actually has testing for both children and adults. Frisco has 2, ATA Healthcare, and then there's an urgent care for kids facility there. And then throughout the county, we have LabCorp and Quest Diagnostics. So again, whether it's testing, whether it's PPE, we've been able to tackle those in the state and here locally in Collin County. The testing, I think the doctor was referring earlier, we're going to have to do substantially more testing in the antibody arena. And so more is coming in that area. But thank you for that question. It was a really good question. It's been a big focus for the state.
Okay.
Gary, appreciate that question very much. And I'll just tell you one feel-good story that has come out of this, and that is in McKinney, Texas. There's a paint company that saw their paint orders slow down, and they have shifted, and they're now making hand sanitizer. And they're full tilt making hand sanitizer literally by the steel drum of hand sanitizer, and so they're helping to fight the COVID-19 by doing what they can do by converting their business. And so I think we should all be proud of people rising to the occasion and helping in this really difficult time. Our next question is for Lee with the Social Security Administration. This is a question that came over the web. So we are having people who are listening to this telephone town hall meeting on the web right now, and they are asking their questions on the web. And so I'm going to read the question. And so I keep logging on the IRS website, but keep getting, quote, payment status unavailable, close quote. How do I get past this error message so I can enter my direct deposit information? Tanya, do you have an answer to that question? Tanya. Oh, I'm sorry, Lee, I'm sorry. Lee,
Okay,
do you have an answer to that question?
No.
The question's from Tanya. Tanya asked the question. Lee, you're answering it. Okay, Lee.
Okay, thank you. And when you're asking about the direct payment, is this from Social Security or what website? Social Security website or IRS?
This is IRS. This is an IRS question.
Right, and we don't have any information on that as a different agency. I would just say keep trying the best I can do. But the IRS site is only for those who want to declare minor children under the age of 17. If they're getting Social Security or SSI, they don't have to do anything. It's going to start coming next week regardless. The only ones who need to fill out them are non-filers with minor children.
Good to know. Thank you for that. And if you still have a question after that answer, Tanya, and you're listening online, Lee, thank you for that answer. If you still have a question, reach out to my office. We're happy to help you go through that and understand that. And there are a lot of questions just because there are a lot of new federal programs, so really appreciate that. Next question is for Tina with AARP. Judy in Plano has a question. Judy, what's your question?
Hello, can you hear me?
Yep, we can hear you.
Hi. I actually have 2 questions. One is I'd like the lady who did the AARP website to repeat that for us. And 2, I'm trying to figure out why we're not able to get tests when you're actually having symptoms before you're about to die. Because by that time, most people actually know they have the disease. But when you're actually having other symptoms, it's helpful to be able to figure out what that is. It seems as if it seems not quite finished. It seems as if maybe they need to change the conditions because even though we've been to the doctor says, well, we can't give you a test even though we think you might have it because they're not allowing us to give you a test. And the other part of that is it possible to help us get that antibody test because that would reduce anxiety and increase our mental health and productivity.
Absolutely. Great questions. So first, I'm going to get Tina to give the website again for AARP. Tina, what is your website again?
Sure. It is AARP cs.org/coronavirus. And that is our clearinghouse of information website.
Super. Thank you. And I apologize for the dog barking in the background. I am at home, and sometimes the dog barks. So as we're all working from home here, so I appreciate that. And then Dr. Winter, if I could call on you and ask you what is the criteria for getting a test? And you mentioned that earlier. There is a criteria, but could you just describe that criteria, and then also talk about and again, just reiterate when you expect antibody tests?
Yeah, if your symptoms are significant, if you are significantly short of breath, get short of breath walking upstairs, if you have significant weakness, if you get confused, you need to go to the emergency room, and there's adequate testing there. If you have milder symptoms, you might want to stay out of the emergency room, but there are a lot of coronavirus patients, although we do take great precautions to make sure it doesn't spread from one to the other. But the testing stations are designed right now for people with minor symptoms. I say minor, the three that initially we talked about were cough, shortness of breath, though not extreme shortness of breath, cough, shortness of breath, and fever. Then we learned that fatigue was also an important symptom of this. And now we've learned that a minority of folks have actually abdominal symptoms, nausea, vomiting, diarrhea. And then a further smaller minority have loss of taste, loss of smell. Any of those symptoms could be due to coronavirus. If you have those, then you should seek out testing. Now, the testing is not widely available, but should be in a couple of weeks. That's to test to see if you have the virus. That's where they put that swab up in your nose, and they can test that and see if the virus is actually there at that point in time. So if you have no symptoms or very mild symptoms, and some of those folks were just saying stay home because we're having trouble getting testing, but we should have that hopefully fixed in the next week or so. That's to test for the virus. Now, the antibody testing is a blood test. And that's going to be very important to tell who has had the virus and who may be still having the virus active. There are two different types of antibody tests. IgM tells you if you have it right now. IgG says you've had it and you've built up some immunity to that. So those tests are going to become available also hopefully in a couple of weeks. We've got plenty of machines. We don't have the chemicals to make the machines work, but those are on the way, we're being told. And hopefully that'll be in the next couple of weeks. But stay in touch with your local representatives, stay in touch with your doctor. The hospitals are very on top of this also, because we're all waiting for that testing to come, which is going to make a big difference in how we take care of the population as a whole.
Thank you, Dr. White. We really appreciate that. Tina, thank you. Judy, thank you for asking that question. Tina, thank you for your answer. And if you've enjoyed this telephone town hall meeting and you just want to know about when the next one is, and there's no obligation, no obligation to do anything, but we'll just let you know when the next one is. Just hit 1 on your phone right now. If you hit 1 on your phone, that just lets us know, hey, this person enjoyed it. That way we'll make sure you get a voicemail for the next one, to make sure you get an email for the next one. That we'll let you know whenever the next telephone town hall meeting is. Really appreciate everybody listening on the line. This actually has been the most popular telephone town hall meeting I've ever done. So a lot of people are listening. Really appreciate the participation. The next question is for Lee with Social Security Administration. Tim and Lucas has a question about the stimulus check. Tim, what's your question?
Yeah, thank you, Congressman Taylor. The current stimulus payments are based on 2018 tax returns. So the question would be, how do people who have since retired and are now on Social Security get their new lower income reflected in the stimulus calculations?
Lee?
And actually, thank you for that question. We're using the 2019 1099s that were sent out, I believe. And those who have filed income tax for 2019, that is the information that is used. And I'm sorry, could you repeat the question in its entirety?
Yeah, and so the rest of the question was how, if you haven't filed a tax return, how does the IRS know who to send a check to?
Then I would recommend filling out that non-filer. If you don't want it to go through 2018 because it was a higher amount, I would do the non-filer, or simply file your income tax already, if you are ready to do so, rather than waiting until July 15.
Right, and so, and just to build on that, so there is on the IRS.gov website, there's a link for you to go if you have not filed, Tim, last year and you're concerned about that, you can go in, file, put all your information, and that way they know where to send the economic impact check. That's the technical name for the term of our economic impact check. So that's how you can get your economic impact check. So, Tim, thank you for asking that question. I know a lot of people have that question. And then just to reiterate, if you're on Social Security or SSI, checks should be wired in next week for people. So really appreciate that. And this is our final question. And again, if you've enjoyed this and you want to find out, if you want to know about the next call, the next telephone town hall meeting, and if it doesn't work for your schedule, we'll just keep letting you know when they are. If you want to know about when the next telephone town hall meeting is, just hit 1 on your phone right now. This final question is for our 2 state reps, and we'll go in district order. So we'll go with Matt Shaheen in House District 66. Aline from Plano, you have a question about opening Texas up. Aline, are you there?
Yes, I am. I'm just wondering that as things start to open up, if the standards for doing business will be standardized across the state. For example, right now, actually in the past week or so, I've been driving down into Dallas County for food because I know there that all the employees will be wearing masks and that customers are expected to, and that's not standardized in Collin County. So as more businesses open up, that's going to become more of an issue. Will there be some standardization?
Representative Shaheen, do you want to take on that question?
Yeah, definitely. Thank you. So when you talk about standardization, typically what we do from a state perspective is we recognize the fact that Texas is a very diverse state. So we have very rural parts, we have urban, suburban areas. So the approach that we've been taking is the governor will have executive orders that, for the most part, set somewhat of a baseline, and then the local jurisdictions, whether it's the county or the city, will then add the restrictions on top of that. So that's why sometimes you'll see a little bit of a difference. Although I will tell you, I've been to several of the food banks in the area, whether it's like Minnie's Food Pantry or the North Texas Food Bank, and then a lot of the grocery stores, they're all using masks now for their employees or people that are volunteering to distribute food. So you are seeing more of the use of masks. But so sometimes you'll see those differences, though, that I think you're referring to. I will tell you that the county judges, so Dallas and Collin and Denton and Karen have all been trying to work together and coordinate. So there's some similarities as well as the city. So I think you'll still continue to see an approach from a statewide perspective where we're going to respect the differences of just how diverse Texas is. But I think you also will see more of the local jurisdictions working together for some more consistency. I'm fully cognizant of the differences between Dallas County and Collin County, but I think you will see a little bit more collaboration between the elected officials as we move forward. Thank you for your question.
Representative Jeff Leach, House District 67. Do you want to add on to that?
Sure. Well, Representative Shaheen did a good job of laying out the issues. The only thing I'll add is that this time next week, we're going to have a lot more clarity, policymakers and all Texans, a lot more clarity when the governor announces his order next Monday. The statewide strike force that he put together will be releasing their plan to reopen Texas. And a lot of those details, not only for employers, but for employees, for consumers, yes, but also for the places, the folks that run these establishments, all of those I am very confident are going to be made clear in the governor's order next week. We're working very, very hard. Be assured we're working very hard and are fully committed to protecting the health and safety of every single Texan. At the same time, we all recognize that we've got to get Texas back working again. And next Monday, when the governor announces his order, I believe we're going to have confidence and consistency across the state to be able to achieve both of those objectives.
Thank you for that. I really appreciate and I think we're really fortunate to have such great guests on here to answer these questions and really give us information that really truly affects our daily lives. And with that, I'd like to start closing this out. There will be an opportunity If you want to ask a question, leave a comment, need someone to call you back about a particular issue, at the end of this telephone town hall meeting, you can leave a voicemail. We get back to every one of those. I personally call many people back that leave specific asks there. So if you've got a specific thing that you want answered, leave your message on the at the end of this in the voicemail. But I just wanted to give a brief couple minutes. I want to give 1 minute each to Representative Leach and Representative Shaheen. Jeff, do you just want to take 1 minute to close this out?
Sure, Congressman. Thanks again for hosting this telephone town hall, for all you're doing for us in Washington and here at home, and to each of you for joining us. The one message that I want you to remember, if nothing else on this call, is you've heard others say it. We truly are in this together, and what we're doing, it's working. It's working to slow the spread, to keep Texans' health and safety. Of course, we mourn and are very sad about the loss of life and the Texans who've been impacted by this terrible virus, and we've got to continue to focus on minimizing that negative impact. But the light is here at the end of the tunnel. If we continue doing what we're doing and stick together and lock arms, we're going to beat this. We're going to win, and we're going to be stronger together, not only individually, but as a state of Texas. So thank you. Keep up what you're doing, and reach out to us if there's any way that we can serve you. God bless.
Thank you, Representative Leach. Representative Matt Shaheen, closing 1 minute remarks.
Yeah, thank you, Congressman Taylor. Just thank you for everybody that's participated. It's so important. We desperately want to hear from you. We want to answer your questions. We don't want any question unanswered at all. So any type of follow-up that you need to do, we'll get the answers to your questions. We're going to continue doing these virtual town halls. I think I'm doing about 2 or 3 a week. I would just ask you, we're having success. We're making progress. The light is at the end of the tunnel that we can see. Just please continue to follow the guidance from our healthcare professionals. You know, we've got some of the best doctors and hospitals here in this community. We're just blessed by that, and we're going to get through this. You're not alone, and we're just working almost day and night just to get through this with you. So again, if you need anything at all, please reach out to our offices, and we'll continue to be communicating with you. God bless each and every one of you. Just please continue to pray for our state and our nation as we get through this. Thank you all very much, and thank you again, Congressman.
No, absolutely. Thank you. And I just want to thank, again, our guests, State Representative Jeff Leach, State Representative Matt Shaheen, Tina Tran with AARP Texas, Dr. David Winter with Baylor Scott and White, and Lee Alvear from the Social Security Administration. Thank you for being on here. Appreciate every single person for taking the time to listen. I appreciate your engagement in our community. Appreciate you listening. And I just want to recognize the tremendous sacrifices that we as Americans are making. There is a medical crisis which has resulted in tremendous hardship, and the economic crisis that's gone with it has just been absolutely enormous. It's a challenge unlike the likes of which we've never seen before. And I'm very grateful for every one of you and the sacrifices that you're making, because the sacrifice we're making today is going to pay off in a big way. And I think it's already paid off. I think that watching these absolutely horrendous death projections that came out at the beginning of this were just absolutely staggering, and we're certainly way below those. There's a lot of hard days ahead, a lot of difficult decisions that have yet to be made, but I agree, there is a light at the end of the tunnel. And I mean, the fact that we're beginning elective surgical procedures tomorrow, that we're opening up our state parks tomorrow, that we're going to see further opening of our economy here in Texas over the next several weeks. I think we've got some clarity on that really speaks to what we're doing is working. It's not over yet, but we're going to keep on through this. And just know that our offices, and I'm speaking for Representative Leach, Representative Shaheen, and myself, Van Taylor, your congressman, I'm here to help. We want to help you with whether it's unemployment, was the payroll protection plan, whether it's helping you with an SBA loan, whatever the case may be. We're here to help. We want to assist you, and together we're going to get through this. These sacrifices are worth it. We are saving the lives of our friends and neighbors, of our families. It is worth doing, and I think that it is incumbent on us to do it. I'm incredibly proud of how our community has pulled together, whether it's people volunteering at the food bank, whether it is businesses turning themselves inside out to make hand sanitizer. We should be proud of what we've done as a community. We should be proud of what we're achieving as a country here and now. I'm incredibly grateful for the opportunity to serve you, and please reach out if we can be of help at any time. And I want to say thank you so much. If you stay on the line, you will actually be on a voice. You can leave a voicemail for any one of us, and we'll get back to you. Thank you, and God bless.